Thank you for meeting me today here in Copenhagen. The medicines patent pool, as you know, is about making sure there's access to treatment, affordable quality treatment to those who need them. And we're interested to know what WHO is doing in the Eastern European region.
Thank you very much for approaching us. Our region is very diverse. We have 53 countries, 950 million population. Very important to know the epidemiological situation of tuberculosis, HIV and viral hepatitis, also wide variety we have in the region. Our focus is mainly in Eastern Europe, Central Asia, because the main burden of the disease in that region. Our main work at WHO is to provide policy guidance to the member states to make sure they adopt the latest recommendations when it comes to treatment, to make sure the effective treatment is available for all the patients. So we really work closely with the countries to make sure the universal health coverage as such is being implemented.
So talking about TB, where do you see the treatment challenges at the moment?
The main challenge that we have is basically, as I mentioned, the incidence is coming down, tuberculosis incidence is coming down, but drug-resistant TB is still worrying. So if the trend continues like that in the future, we will have drug-resistant TB replacing the drug-susceptible TB. So we need to make sure that access to new medicines, bedaquiline, dalamanid, and also repurposed medicines like linezolid is in place. And that's where a medicine patent pool can play an important role to make sure these medicines are registered, but also the price is affordable for the ministries of health to cover. You
mentioned that one of the things that WHO does and that you do in the region is actually work with the governments of these countries to help them implement the policy. How do you, as WHO, work at that level with the ministries of health?
Very important point is to make sure that everything is started with proper planning. And proper planning is based on knowing your epidemiological situation, meaning to know what is the burden of the disease, which population or key populations you need to address first, and then scale up. We work very closely with the ministries of health, first of all, to see whether they have a national plan. So the first step is the proper planning, that we work with them, knowing also the epidemiological situations, which population you need to work with. And then the next step, of course, very important to make sure that they have the right treatment. And then also access to quality and price, which is very important, because if the price is too expensive, we cannot afford to put everyone on treatment. And very important for hepatitis C, because we have a cure for 3 months treatment. So the investment case which is need to be made for the ministries of health and Ministry of Finance in the countries.
Who do you think are the partners that need to be around sort of the table working on this with you?
We need to have all the government, all part of government, but also whole of society to be engaged. Civil society have a very important role to play, because many of these people affected by disease, they know the process they went through. So it's extremely important to get them on board when you're preparing a plan, because they are key populations, drug users, commercial sex workers, migrants, prisoners. They should be also having a seat where the planning is prepared in the terms of preparation of the national plan for implementation. For us, very important to leave no one behind, and irrespective of the level of income, we should make sure access to treatment available for all the countries of region. So these are the major partners, but also important partners like Medicine Patent Pool, because you guys have a knowledge and expertise how you can manage to bring the price down, but also in terms of licensing and also in terms of working with national drug regulatory authority. These are very important aspects. WHO is also working with these ministries, but having you on our side and also leading some areas, for example, on HIV, TB, viral hepatitis, is very, very welcome, because that's where we can have an impact and we can bring the prices down and but have a medicine which are affordable for people.